Advocates, I'm Rachel Smith. We are now learning more about Speaker of the House Mike Johnson's past. According to a CNN review, Johnson partnered with an anti-gay conversion therapy group in the mid to late 2000s. Conversion therapy is a discredited practice that seeks to change the sexual orientation of gay people. The practice has been widely condemned by the medical community. Johnson was working as a lawyer at the time and apparently gave legal advice to an organization called Exodus International. The group promoted conversion therapy, and when it shut down in 2013, its founder apologized for the pain and hurt they caused. And as we reported, the Louisiana Republican has frequently disparaged queer people in his interviews. Well, the ambassadors from Israel and Palestine are making their cases to the UN Security Council for help with aid. The meeting was called after Israeli expanded their ground operations into Gaza. A large majority of UN member states voted for a humanitarian pause to protect civilians. Israel says it has the right to defend itself. On October 7th, Hamas militants attacked Israel, leaving more than 1,400 Israelis dead. Israel's ambassador is wearing a yellow Star of David patch to send a message.
Some member states have learned nothing in the past 80 years. Some of you have forgotten why this body was established. So I will remind you, from this day on, each time you look at me, you will remember what staying silent in the face of evil means. Just like my grandparents and the grandparents of millions of Jews, from now on, my team and I will wear yellow stars. We will wear this star until you condemn the atrocities of Hamas and demand the immediate release of our hostages. We walk with a yellow star as a symbol of pride, a reminder that we swore to fight back, to defend ourselves. Never again is now.
Since the war began, the Gaza Health Ministry says over 8,800 Palestinians have been killed. The Palestinian ambassador is calling Gaza hell on earth.
Mr. President Dag Hammarskjöld said, and I quote, "The United Nations was not created in order to bring us to heaven, but to save us from hell." End of quotation. Gaza is now hell on earth. You've heard that not from me, you've heard it from Lazzarini and many others. Gaza is now hell on earth. Saving humanity from hell today means for the United Nations to save Palestinians in Gaza.
The ambassador wants the Security Council to follow the General Assembly's example by immediately establishing a durable humanitarian truce. Well, the LGBTQ+ community face a variety of challenges when they are diagnosed with cancer, when it comes to care, treatment, and support. The National LGBT Cancer Network is working to remove those health disparities by educating, training, and advocating.
As we know, marginalized communities, all kinds, face health disparities. And those sometimes, depending on which marginalized group you are, those can increase. Can you kind of share some of those disparities and what they look like when it comes to the queer community and cancer?
Of course. So I would say one of the main things that we experience or that we see in the LGBTQ plus and trans communities when it comes to healthcare in general, but more specifically cancer, is that medical mistrust is a huge reason that there is a lack of care. 1 in 6 LGBTQ adults, and more specifically, 1 in 5 transgender adults have avoided care because of their previous experiences of discrimination within the healthcare field in some capacity. And so those are, stats that really lead to some more of the disparities that we see. For example, a lot of LGBTQ folks don't bring their families or their, chosen families or their support community within their care continuum as much as like our hetero and straight and cisgendered communities do. And so we have a lot of, I can go on for days and days about like what are some of the disparities that we face specifically into cancer. But one of the things that I would say, if you go to the root of the problem, is the medical mistrust. And so I'd say it's one of the really important things to know our individual risk factors, but also to shift the responsibility away from marginalized communities, the queer community specifically, and really put the pressure on some of the systems that really reinforce some of the discriminations and disparities that we experience.
Yeah. What about on another side, when it comes to like data collection and management, and specifically when it comes to cancer in the queer community, does it need to be more? Is there need to be better? Like what's going on with that?
Oh yeah. Oh, you're gonna have me on my soapbox all day, Aaron.
There you go. We're ready.
But I would also say, right after the medical mistrust that our community experiences, there's also a lack of surveillance data when it comes to cancer and the LGBTQ population. And a lot of that stems from there's not a lot of population-based surveys that collect information on sexual orientation or gender identity. And so that really puts us in this position where we don't have all of the research that we need. More specifically, like what could that impact look like on our communities? For example, something like breast cancer, which is a hormone-driven disease, can really interfere with someone that is going through a hormone gender-affirming therapy. And since we don't have the data in terms of like what would be the interactions of that, it might really hold someone back from going through with that gender-affirming hormone therapy if it gets in the way of also the cancer care treatment that they're receiving as well. And so we need more data when it comes to population-based surveys that our governments are collecting from us. We also need more data in medical spaces. Like when you go into the doctor, like we don't have a lot of data on the incidence and mortality rate because medical centers don't really collect a lot of data on what your sexual identity or gender orientation is. And so when we don't have that information, it's really hard to put implementations and interventions in place that position people of sexual, gender, and minority groups in the best possible place to receive the best care that they possibly can.
And you touched on it a little bit just now, but can you kind of expand a little bit more on how, when it comes to heterosexual or, treatments versus like those people who identify as queer, how those treatments can and impacts be much different, right?
Mm-hmm. Yeah, and I would say I'll start off by saying that we see their treatments being a little bit different because like the source of how they're even getting identified as having cancer is a lot different as well. So specifically, I'm going to go back to breast cancer again, because that's my wheelhouse and my biggest area of expertise. But breast cancer patients specifically that identify as LGBTQ are diagnosed far later than their first onset symptom than our straight and cisgender communities are. They also have a greater rate of reoccurrence, and then they also have a greater, a longer time after they've been diagnosed of even being treated for the cancer that they have been diagnosed with. And so that is a direct result of the medical mistrust, but is also a direct result of healthcare providers not adequately evaluating a lot of the intersecting identities that people that are queer are coming into this space and holding as well. You might be queer, but you also might be a Black woman, and if you have those intersecting identities, it kind of like layers itself in terms of like what are some of the barriers to care that you're receiving.
Well, thanks so much for joining us today. You can watch us live by downloading the app in our Apple or Google Play Store, and be sure to subscribe to our YouTube page. For the Advocate Channel, I'm Rachel Smith. Take care.